supposedly hypothyroid, and I take armor thyroid. What's your opinion on that? If they don't like it, how do we know?
In other words, belonging, I'm still on thyroid and would like go to armor. So.
Let's start with the first question, which is hypothyroid, is what you're telling. Hypothyroid is and will become one of the most popular diagnoses of the decade, and probably of the next several decades. There are several reasons for this, not the least among them the fact that doctors always need to come up with a new diagnosis every decade so that they can sell you the new fear and the new drug. I'm not against doctors when I say that. I think that there is, when we go to doctors for emergency care, life and death care, that they are certainly amongst the best providers on the planet. Western medicine do an incredible job in these type of emergencies. But the allopath who deals with all disease isn't our best source of information in attempting to create, augment, or otherwise regain health. Many features of the standard American diet drive various hormonal systems awry in the direction of hypothyroid. They can result in hypothyroid, or the symptoms of it, as opposed to you actually having a problem with the thyroid. It's like saying, I have headache, while the whole time you've been banging your head against the wall. Well, we understand you actually don't have headache in and of itself. You have the results of banging your head against the wall. The results of standard American diet, one of them is to give symptoms that are similar to a person who actually had a thyroid problem. By removing the cause of the problem, taking people off the standard American diet, putting them on the low-fat, raw vegan diet, we find in almost every situation that the hypothyroid situation clears itself without any issue. That, in fact, there are people with hormonal disorders. There are, for instance, heavy people who tell us it's their hormones, and probably in reality about 1 in 1,000 of those people do in fact have a hormonal concern. The rest of them just have hand-to-mouth disease. Wrong food choices. As far as weaning off, it's not appropriate for anyone other than the person who put you on the drugs or yourself to wean you off. There are certainly plenty of methods to do it. If it were me, I would do it gradually, knowing that the likelihood of any emergencies occurring from doing it less gradually are next to nil. This isn't one of the drugs that you have to say, well, I have to go incredibly slowly with this. And as far as the actual mechanics of how to do it, what I normally recommend is taking half as much of the drug twice as often. So you initially lower the dosage. There's less jolt on the system. By taking a daily amount of whatever the daily recommended amount is, and putting that much in a glass of water, and then you can control how much of that water you drink. Does it take you 36 hours to drink the whole thing? Does it take you 30? Does it take you 48? You can control the dosage totally. Whereas when it's in pill or tablet or that type of form, it's really hard to control the dosage. Once you dilute it into water, you've got complete control, and you can say, well, I want to take little doses often, or I want to take 2 days worth but spread it out over 3 days. I want to take 5 days worth but spread it out over a week. You can keep playing with it. The thing is, buried treasure is 28 feet down, and I show you where to dig. You can't start spending after having dug for a week or dug for 7 feet. You have to get all the way down there. In other words, you plant corn, you don't get to eat corn the next day. The same thing can be said for healthful living, raw food diet. You make dietary awareness, you don't yet get to reap the harvest. Putting the action behind the awareness only initiates the process of beginning to reap the harvest. Some of these changes that happen in our physiology take a bit longer.
That particular drug, they recommend always taking it at the same time every day. It'd be kind of hard to do with water.
Again, what I'm saying, you can do it any way you want. It's really not for me to guide you in that issue. Not being your doctor, it's an issue between you and your doctor. It would not only be immoral, it would be, or at least according to most people, immoral. It would certainly be illegal. And that isn't so much a concern as something that I respect. They say, take it at the same time every day. They say, take it at all. They say, eat meat 3 times a day, and they say that you can't live as a vegan for more than 9 weeks or you'll die. They say a ton of stuff that we don't agree with. I would consult with your doctor, express to him your desire to get off of this drug. How does he recommend that you do it? And then you either like his suggestion or you don't. But I'd make it clear to him that you expect changes because you have made lifestyle changes and you do not feel attached to this condition. Sure. The synthroid part?
I at one time I went off of it totally. So I'm really sort of afraid to. I'm not taking any other medication. The only one I'm taking.
The question is about synthroid, apparent thyroid problems that are obvious to the point of goiter, and at this point, even then, the ability for you to experiment is available without making direct doctor-patient thing, because it's not where we sit. But you are always entitled to experiment with your own body, and you can play with the dosages in small degree, gradual things that will not be the same drastic swings that you would get from just saying, okay, I'm going to stop taking this. Obviously, just stop taking it and you will notice profound things. You can get in trouble and it becomes hard to stabilize again. But gradual, you can see exactly what's going on. A 10% reduction should make literally no difference, no discernible difference. And a month later, if it makes no discernible difference, another 10% reduction will probably again make no discernible difference. We're talking direction, not speed. You got to remember, even with the blood work, that blood work is based on standard American diet norms. So you don't know what should be normal for raw food. Fortunately, at this point, there are some studies being done with raw food blood norms to begin to get a sense. I'm working with a woman who's doing some raw food science research that I don't even want to begin to say how long it'll take her to come up with results, because she's only just begun, but she's certainly a pro-raw food person doing some serious science on the raw food impact, and we're talking about going deeper into developing norms for raw fooders, norms for healthy people, about going deeper into developing